Hi everybody, welcome back. We're excited to be with you here again today. We are the Hearing and Balance Doctors. I'm Dr. Ryan Whitaker.
I'm Dr. Rich Luekenga.
We want to talk with you about kind of an interesting topic today. Our question of the day is, why do people hate their hearing aids?
You know, Dr. Whitaker, I think sometimes people hate their devices because they don't feel right. The physical fit, the way it actually sits in the canal, bothers them. The ear canal, it turns out, has some cartilage in it, and then it goes to bone. And as it transfers from cartilage to bone, it becomes more sensitive. And so some of us have nerve endings that are quite sensitive. And so there's a real art to getting that physical fit just right for the patient.
I agree with you. If the physical fit isn't right, you won't wear them. You won't like them. It won't feel right. It won't look right. It'll be hard. So physical fit's a big one. I think that ties in a little bit with selecting the most appropriate hearing aids. I've seen over and over, and I bet you've seen this too, people come into our clinic with hearing aids that they're frustrated with, and it was just a poor choice for them. Whether they got it online or whether they got it someplace else, it just was not the right choice for them.
Mm-hmm. Another thing that can cause issues, I would say, in probably the majority of our patients, is this idea of an expectation that you put a hearing device in your ears to hear well, and that you're going to love it right off the bat. One of the problems is that your brain is used to hearing maybe this much sound, and all of a sudden you're giving the brain a much more robust signal to process. Kind of like when you hurt your leg or one piece of your body becomes disabled or kind of not working at its optimal performance, and you have to rehab that back. You have to allow time for your body, the process of your body to heal. And then all of a sudden your arm and your leg is working much better and it's okay. And so probably a realistic expectation is more like 3 to 6 weeks, sometimes 2 months, for an individual's brain to fully adapt and recalibrate to these sounds.
Yeah, once again, I agree. You've got to have realistic expectations of what the hearing aid can and can't do, and also that understanding that it's going to take time. It's not going to be immediate to get used to it. Mm-hmm. Here's our final point of the day. Why do people sometimes hate their hearing aids? Well, sometimes they don't have any place to go for help. Something goes wrong with their hearing aid. Maybe the little earbud comes off. Maybe it's plugged up with wax. They think it's broken. They don't know where to go to get the hearing aid serviced or helped. I tell people over and over again, the most important thing you can do to succeed with your hearing aids is to find a good clinic, find a good doctor, find someone that really is going to take care of you and help you throughout the process. I have an uncle in Florida. He said, "What can I do to succeed?" I said, "Find a good clinic." You've really got to find a place where you can turn for help.
I totally agree. Sometimes you look at the clinician that's helping you, whether they're a doctor or not, and you have a pretty good relationship, but you might want to take a look around you and just say, is this the team that I want taking care of me for the long haul?
Yeah, absolutely. And do people sometimes hate their hearing aids? Yeah, sometimes they do. But if it's done the right way, people succeed all the time. And we'd love to help you succeed.
We're really trying to get the technical component correct here in the clinic, but also there's an artistic side to this, to making it right and taking pride in what's done.